Alrighty, sounds like we had some technical difficulties. Hopefully you all can hear me now. So we'll go ahead and get started again. So my name is Cassie Jones. I am one of the senior epidemiologists over in the Vaccine Preventable Diseases and Immunization Program at the state of Tennessee. And let's go through today just a quick update about COVID-19 vaccines, and then we'll get into some questions and answers to see if we can help you all out with some more information. So, as always, you can find our COVID-19 vaccination plan on our website. This plan is an outline of how we receive vaccines, once we receive them, how we allocate them and distribute them, and then how we administer them to the population. So to find that plan, you can go to www.tn.gov/health. You can click on this nice little gold bar, and that'll take you to this page right here with a lot of different icons. This icon is actually moved up to the top, and so it'll actually be placed here, and it'll say COVID-19 vaccine information. You can click on that, and you can find our updated dashboard, which has data that's updated every Tuesday and Friday about the amount of vaccines we have given across the state, how much we've received as a state and delivered in our facilities that are providers. So a lot of good, rich information there that you can find. So in our plan, of course, is an iterative plan. It is a working document, and always check for updates and changes. I think there's another plan update scheduled, I think for next week, probably Wednesday, so make sure you look out for that. So let's talk a little bit about our vaccine allocation phases. Like our plan, this is always, subject to change, and it's being updated as we learn more about the vaccine and the virus and the epidemiology. And so this looks a little bit different probably than the last time you were on this call, and this definitely looks different than what's on our website. So I'll just run through what these changes are, and this is a little bit about what to expect coming forth in the new plan. So this right here actually isn't in our current plan, but it will be in the plan starting next week. And so because we have a limited amount of vaccine, we set out our phasing. And so that way we can get the little bit of vaccine out to do the most good while we have it. And so we start out with our phase 1A1 population, which all of our counties are in or have finished, but most of them are still in that area. It's inpatient and other high exposure healthcare workers. So these are like our hospital workers who have direct patient care. Residents and staff of long-term care facilities. And so with this, we've partnered with the Federal Pharmacy Partnership Program with Walgreens and CVS, and they are vaccinating our long-term care facility residents and staff. 18-year-old, those who are 18 years of age and above who are unable to live independently, and our first responders. Going on to phase 1A2, and I know that all of our rural counties are in phase 1A2 as well. I think the metros may not be, and that's something I can show you on our website where to find that information. And so for phase 1A2 is all other healthcare workers, so these are like our outpatient providers, dentists, other types of healthcare workers that aren't within a hospital setting, and then our death care workers, so our funeral and mortuary workers. So you see this nice green dot in the middle, and so that is something new. We do have in our current plan the simultaneous age-based criteria. But one thing that's a little bit different and that will be changed in our next iteration of our plan is that we're actually wanting to go ahead and vaccinate our 75 and older population prior to really pushing through to that 1B population. And so we're currently working, and I'm sure if you've seen on the news, we are vaccinating our elderly population that's 75 and older. That are coming in currently, and then we'll actually also move to 70 and older as well. But we're not there yet, so we're just currently doing 75 and older. And then we'll go to phase 1B. And phase 1B is school and child care staff and other first responders. 1C is individuals who are age 16 years of older with high-risk comorbidities, and those high-risk comorbidities can be found in our plan. critical infrastructure, which is in 2A and 2B, and that can also be found in our plan. And then in our phase 3, we have congregate living, grocery workers, and corrections residents. And then, of course, you see this nice green bar at the top. Aside from our 75 and older population, this will run simultaneously with the other phases. So as we're, vaccinating 1C population, we may, and we don't know how this is going to progress yet because of vaccine supply and uptake and all of those factors, but we could also be simultaneously vaccinating those who are 55 and older, 60 and older, or something like that. So this is simultaneous with our phasing after we get through our initial 75 and older and then 70 and older populations. So a little bit about our allocation and our rollout. So as you know, this is a time where we have a limited supply of vaccine. And in December, we got a nice bolus. So this is when the vaccine actually came out. And so we got a nice bolus of vaccine. And so that was to the tune of about 382,000 doses. We put this in hospitals, so about 65% of that, and that was really to hit our 1A1 population. We also put it in health departments, about 35%. And then we put a good amount of our vaccine into the long-term care facility partnership. And they actually, how they do that is they take that off the top of our allocation before we actually get that number. So that's not even open to us to allocate. They just go ahead and take that completely off the top and send that to the pharmacies that are doing the long-term care facility partnership. And then we get the rest of those doses, which is that 382,000 doses. In January, we're scheduled to get at least 184,000 doses. It's a little bit of a different breakup. It's health departments have about 2/3 of the vaccine, around 67%, and hospitals are getting about 32%. We're also sending vaccines to independent long-term care facility pharmacies. So long-term care facilities who did not sign up with a federal long-term care facility partner, so those are Walgreens and CVS. So if they did not sign up with one of those, we partnered them with an independent pharmacy, and they're receiving their vaccine from them. So we're also allocating doses to them as well. We're still a little unsure of how much we're getting in February. We don't have good visibility on that yet, but we don't think we're going to get less than what we got in January. Things that could happen, this is all planning stages right now, obviously, since we're still in January, is working with, through a different federal pharmacy partnership, working with Walmart pharmacies, and these would be in counties that have a high SVI. So we'll prioritize those because we don't have enough vaccine to roll out to all Walmart pharmacies because there's a lot of them in Tennessee. So we'll prioritize those that are in a county with a high social vulnerability index first. We'll also, of course, send it to health departments, safety net providers where they have a low social economic status, so prioritizing those with the lowest, that are in areas with the lowest SES first, hospitals still, and then independent pharmacies as well to finish up those long-term care facilities. And then March, we're really looking forward now. We definitely don't know how much we're going to get in March. Again, we may be putting even more into the federal pharmacy program. That's what is showing over in February with Walmart. Maybe something with the Tennessee Board of Regents, so giving vaccines to a partnership with our universities, so maybe they can help us administer vaccine to the public. Again, our Walmart pharmacy through the federal pharmacy partnership, our safety net providers, independent pharmacies, medical clinics, health departments, and hospitals. So again, this is all in planning stages, and it is very, very dependent upon the amount of vaccine we will receive. And so just to give a little bit about the timeline, if you've been on this call before, I think you've probably seen this nice chart in front of us. We stole it from CDC. But it shows the distribution timeline in different phases. And the first one is the limited doses available. We're actually still here. We've moved quite a bit along in the last month, but we're still within this limited doses available where we have a constrained supply and a highly targeted administration plan. we're moving up into, hopefully soon, months maybe, into a larger number of doses available, where we have a sufficient supply, and those who would like vaccine, it's more readily available to them in a myriad of different avenues with which they can receive it, different types of facilities. And then we'll get to a time in which we have more demand than, or we have more vaccine than we do demand because individuals have already been vaccinated. And so that's just a little bit of an overview of what a pandemic vaccination plan looks like. But again, we're still in this really early section where we have limited doses available. So to talk a little bit about the vaccines in progress, it's really fun to do this and watch the colors change as we go through the pandemic, because we're seeing more of these vaccines come on board. So currently, you're probably well aware, we're utilizing Pfizer and Moderna vaccine. They both are mRNA technologies. Pfizer, of course, is 21 days in between doses, and it's ultra-cold storage. Moderna is 28 days between doses with frozen storage. Coming up soon, I think I saw in the news that some of these are looking to put in paperwork with FDA, I think in February. Again, I read that in the news, so take that with a grain of salt. But AstraZeneca looks like it's coming out soon, 28 days, or it looks like it could be submitting their paperwork to FDA soon. 28 days between doses, and it's refrigerated, which is exciting. And then the one that we probably heard the most about coming out is the Johnson & Johnson vaccine, which is a replication defective vector, same as AstraZeneca. This one's a single dose, which is new. That'll be different than any other vaccine we've seen, and it's frozen storage. Those that aren't quite as far along in the process is Novavax, which is an adjuvanted protein subunit vaccine, and our Sanofi, which is the same. All right, and so where can you get more information? So if you actually, again, this is the same process as finding our plan. If you go to tn.gov/health, and then you click on our nice little gold bar up there that says information from Tennessee Department of Health about the ongoing novel coronavirus outbreak. You can go down to the COVID-19 vaccine information tab and click there. There's actually going to be 3 tabs. If you haven't been on there a while, it'll look a little different. It'll say general vaccine information. It'll have one for healthcare providers, and then it'll have another one about how to find, how to schedule a vaccination. Wanted to talk a little bit about some tools we now have. I think these are probably new since the last time we spoke. So we have something called the Finding Your Phase tool, and actually I wonder if I can, let's just, all right, it's not gonna let me do it today, but it's this nice website up here, covid19.tn.gov, and you can go to find your phase. You put in, you answer some questions about your occupation, your health, and it can tell you what phase you're in, and you can also either add your email address or your phone number, and they'll send you an email or a text message when your phase opens up in the county of residence that you enter. You can also, there is a map on that same website. You can go in and you can actually, you can hover over these counties, but to find the information, you actually have to do a nice little click, and then you can get the county name, what phase they're in, and then a phone number and a link to sign up if they have that available. I think our rural regions do. Some of the metros may not have that available on our website. This will also tell you what phase each of the counties are in as well. We also have this on our website. If you less like the map and more like a table, this is the table that will tell you that same information. They'll tell you which county, the current phases they're in, and then a phone number to get to that health department to schedule a vaccine if you, an appointment if you don't use the website, although we do prefer you use that link to sign up. All right, I kind of talked about this earlier, but we do have a lovely dashboard on our website. You can find that at covid19.tn.gov. You can also find it, earlier we talked about how to go to that yellow ribbon under tn.gov/health and the vaccine information. You can find the same information there. At the current time, this dashboard is updated on Tuesdays and Fridays, so we should have some new data out for you by probably 5 o'clock Central Time today. You can also go to CDC's website and track the distribution of vaccines nationwide. And what they'll show you is the number of vaccines that they have being distributed to a state, and then the amount of people within the state who have been vaccinated. And so that's a nice little resource to look at nationwide as well. All right, and so I actually have my colleague Natalie Harder in the room, and I'm going to let her talk a little bit about tennis.
Great. And can you answer this?
I can't.
Okay.
Yeah, let's go ahead and let you do it. Yeah.
Hello, good afternoon. This is Natalie Harder speaking, and I'm just going to put everything at once on this slide. So the previous slide showed the dashboard for Tennessee, and so there's a nice kind of segue into the importance of reporting administered vaccine into the Tennessee Immunization Information System. So two big things that we require COVID-19 vaccine providers to do. And the one thing is in Tennessee. And the one thing is to, on a regular basis, reconcile the inventory in Tennessee that shows, okay, so central office right now allocates the amount of COVID-19 vaccine that a COVID-19 provider receives. But then it is up to the COVID-19 provider to go into Tennessee and to accept that order. But then also on a regular basis, we recommend at least weekly to go into Tennessee, into the VOMS module, the vaccine ordering module, and reconcile your inventory in Tennessee, showing how many doses we still have on hand, and update that on a regular basis. That is very important because we look at those numbers. It is one of the inputs into the decisions related to allocation of vaccines. The other thing is, too, on a daily basis, our team reports to a CDC tool called Vaccine Finder per COVID-19 provider how much vaccine a certain provider still has. So by you updating the inventory in Tennessee, it gives us the information to update the CDC tool. So we do that on your behalf. So that you don't have to worry about that. And then the other thing that is really important for providers who have COVID-19 vaccine is then to report the administration of a vaccination into Tennessee, preferably within 24 hours, but it is a requirement, a CDC requirement, to report that within 72 hours. And so very important, again, it drives the Tennessee dashboard numbers, and that is looked at the state level, at the federal level, and it is, again, one of the inputs also into the allocation decisions. So very important to report that. And it is used to send out centralized second dose reminders. So right now, daily, we pull reports and send out text messages, and if we don't have a valid phone number, we send out postcards to those people who are due for their second dose. So if we don't receive the report of what patient received what COVID-19 vaccine on what day, we can, of course, not send out that second dose reminder. So very important to please report COVID-19 vaccination on a timely basis. And then how? So we offer two ways. Either use the mass immunization module, that is one of the modules within Tennessee that allows for fast data entry, or leverage your existing electronic connection between your system and Tennessee.
And if you do use that mass immunization module, you may see some updates coming soon. You may see some updates coming today where race and ethnicity is now a required field in that mass immunization module. All right, so we can get into some frequently asked questions. So the first one is, where is it? So where is the vaccine currently? We currently have it in some hospitals and all of our 95 health departments across the state. We also have it, and one thing that's not in here, we also have it at some independent pharmacies who are vaccinating long-term care facilities, but again, that's for a special population. And then our federal pharmacy partnership at Walgreens and CVS, again, for that special long-term care facility population. Where is it going? So going forward, we are going to utilize our federal pharmacy partnership. I know they have the same names, and that's very confusing, but one's the long-term care facility pharmacy partnership, and one's just the federal pharmacy partnership. We'll put in a request with the feds to be a little more creative next time. But we are going to start working with Walmart stores in February. Again, those are going to be local pharmacies in counties that have a high social vulnerability index. And then we'll also move to FQHCs and community health centers in certain neighborhoods based on their socioeconomic status as supply allows. Again, we're still don't have the greatest visibility on our supply and allocation numbers within February. So this all is dependent upon those allocation numbers. When can I get it? That's a really good question that we get a lot. Again, if you go to that eligibility tool, again, at covid19.tn.gov, you can find what phase you're in. And then if it's not currently your phase, you can get a text or an email reminder when your county of residence that's listed within the tool hits that phase. And then how can I get it? You can either call your local health department, or what we would recommend is visit that covid19.tn.gov website, and then if you go to that map and click on the county of residence or the county where you work, you can go in and sign up to request an appointment. And that's really important. The one thing I'm sure you noticed that I said we do request that you sign up for an appointment online, because we are getting so many calls. Our poor local health departments, there's only so many calls we can get, and so we are getting a lot of them right now. So it's a little bit more of a direct action to go to that website. But of course, you're still free to call your local health department as well. All right, and that is the conclusion of the actual slides we have. And so we can go to the question and answer session. So let me just pull up, again, if you have questions, you can enter them into the question and answer box. All right, and let me just go ahead and pull that up so I can see it well. And we will get started. So, all right, here we go. Technical difficulties are always fun. So let's get started. All right, once we have submitted a provider application, how soon can we expect to hear whether or not we get approved? That's a great question, and that's actually really dependent upon the type of facility you're at. If you remember, we went through a table earlier talking about where the vaccine's going, and so we actually prioritize the onboarding of our providers based on who's going to be getting the vaccine next. So we make sure that we have the appropriate providers onboarded in the right amount of time. And so you should get an email once you have submitted your application, just with general information and how to revisit your application. And I shouldn't say application because it's a registration. Once you submit your registration, how to revisit it if you need to, but it may be a little while, a few days, maybe even a couple weeks before we reach out if we have any questions on that. But no, we are processing it on our end. We just have a huge influx of provider registrations, and we have a lot to go through. And then we are processing them. If we have any questions, we will reach back out to the providers And then once the provider is completely onboarded, you'll get a confirmation email regarding that. So one of the questions was, are we releasing our allocation numbers by county? We aren't, but we are allocating based on population. So we have a question asking if Tennessee has already received all of the doses that we are going to get for Tennessee or for January. No, we get weekly allocations. So we will get a new set of vaccines opened up to us every week. And so if a health department is out right now, they may not be out next week until they are again, until they use them again. But no, we get weekly allocations, not monthly. Where do patients register on the website? So let me actually, I'm going to pull up my screen here and let me see if I can get to a point where I can show that to you. I'll walk you through the process really quick. I may walk you through the process really quick. All right, Jenny, can you see that on your screen? So I always start, because I know my base is tn.gov/health. That's where I go to. So I always start with that. You can go to this red bar, and that's actually the COVID-19.tn.gov website. I'm so used to doing tn.gov/health. That's what I go to first. So if you hover over this vaccines tile, you get to vaccine phases, county vaccine information, and vaccine eligibility. So this right here is where you can send anyone to find what phase they're in. They just put this, they can go through this tool, they'll say what county they live in, enter information about, you know, their occupation, their health status, and then you can put in, it'll tell you what phase you're in. You can put in your phone number or your email address, or neither, it doesn't matter. But if you want notification, only the phone number and email address. And so that's how you that's how you get to the tool. If you want to go to the map, you can go to vaccine phases. And this has a little bit of our phasing diagram. Again, check back next week for an update to that. Here are our phases. So it's a nice just layout of all the phases. Our age-based phases, and then they've actually moved the map on me today. So here's where you can click in to the map to learn more. Oh, I'm not sure what I did there. Okay, sure.
What I'm seeing is the WebEx logo.
Let me see. Oh, okay, you're seeing, okay. And so that's where you hover over the county and you click on it, and it'll tell you the county name, what risk-based phase they're in, which age-based phase they're in, if vaccine is available, the phone number to call, and then how you can go request an appointment. So that's just a little bit of a walkthrough of those two new tools, which I think are really helpful. All right, we have a question about tennis. All right. This one looks like it may just be from one of our regional health departments, so we'll make sure she follows back up with you, Dr. May. The scheduling platform and integrating it with tennis. Yep, so Dr. May will follow back up with you. All right, we have a question about outpatient clinics and whether they should apply to become a pandemic provider. Yes, it's still an option to apply to become a pandemic provider, but vaccine supplies have been so limited that it'll probably be much later before we're able to get vaccine to these providers and the outpatient population or the outpatient providers. Again, we showed the where we're going map and in the table, and even in that, it didn't look like outpatient providers are really going to be hit anytime soon, just because of our vaccine supply. It's so very limited. So yes, absolutely, you're still able to apply to become a pandemic provider, and we can let you know when supplies become available for that, although it doesn't look like it's going to be anytime, at least within February or March. Question about vaccinating, if you're a provider who has vaccine, if you're able to vaccinate out-of-state residents, yes, you can if they're in phase. So a question about when will we receive the influx of vaccines that has been reported by the Fed. We have not actually heard any official word on that from CDC or Operation Warp Speed. We have gotten no official communication through any of our channels, so we do not have any official word on that at all. But we have not seen an increase in our allocation numbers. Someone is asking if someone has antibodies to COVID, should they get the vaccine? There's really great guidance on CDC's website for that. You can Google interim clinical considerations for COVID-19 mRNA vaccine. That's a lot to remember. You can also just Google clinical considerations for COVID-19 vaccine. But they state that yes, it is. If someone has already had COVID, they can still go ahead and get the vaccine. They put in there that since we believe that someone is immune for 90 days at least, that they can wait those 90 days, but they don't have to. The only stipulation of that is that they're not actively ill with COVID to get the vaccine. Absolutely. Someone wanted to know if we could put a link in the chat box to the COVID-19 website, and let me just get back there really quick, and I'll put it in there right now. All right, that should be in the chat box. I show up as Peter Coops. I promise I'm not him. Now I have to get my little Q&A box back up again, so give me 1 second. All right. Is there a plan for vaccinating individuals who are homebound? We are working on that plan. We understand that that is absolutely a need, and we are currently absolutely working on that plan. We have a question for someone who would like an explanation of the mass immunization module for documenting vaccination. So I'll let Natalie talk through that one.
Yeah, so that is one specific module within TANF. So once you are registered as a COVID-19 provider, part of that registration process is setting you up as a user within TANF. And so when you are set up as a user in TANF, we send out training materials. And so one of the quick reference guides that we send out is how to use this mass immunization module. So that first, if you want to leverage your electronic health record system, and you have an interface with TANF, you're good to go. If you prefer to use the mass immunization module, then we send out that quick reference guide, and it's really easy. There's some preparation work that you do before you have a clinic vaccinating, giving COVID-19 vaccine to patients, where you set up, okay, this is the lot number that I have, and so you tie your specific location, your clinic, with the lot numbers that you will be that you will be vaccinating your patients with. And then once you're vaccinating, you key in the first name, last name, phone number, very important for reminder recall purposes. And then it looks, as you key in that demographic information, it looks if there is already a record for that patient in the IS. If there is, it pulls up that entire record. And then you really just have to click, okay, this person received this vaccine on this day, and it goes really, really fast because it automatically ties it to the lot number. So it's a really quick way for capturing COVID-19 vaccine administration.
Great, perfect. Thank you, Natalie. All right, we've had a question about the prioritization of individuals 65 and older and federal guidelines coming out about that. And so we are prioritizing our age group of 75 and older. We're just doing it a little more piecewise because of our vaccine supply. And so we're starting with our 75 and older population, and then we will go down to our 70 and older population, and once that's done, we'll go down to our 65 and older population. We're doing just a little more of a stepwise function so that we can be in line with our vaccine supply. Oh, great question for second doses. How many days ahead of the time will the individual be sent a reminder for scheduling info? So this is a little bit of a two-part question. I'll answer one part, and then I have a colleague in the room, Jenny Dzinski, who can answer that second part for you about scheduling info. So, of course, individuals can get a vaccine at multiple different locations. Currently, right now, it's a hospital within their long-term care facility or a health department. And so anyone who has, as Natalie mentioned, anyone who has a number with antennas, so a cell phone number with antennas will get a text message, a landline will get a call, and if you have neither, you'll get a postcard. Those texts are sent 2 days before. So if it's 21 days for Moderna, you'll get a text on day 19, and if it's 21 days for Pfizer, you'll get a text message on day 19. 28 days for Moderna, you'll get a text message on day 26. And that actually does not have any scheduling information in it. It's just to remind you to go ahead and get that second dose. But if someone has had their first dose through public health, how do they schedule that second dose?
This is Jenny Dzinski, and I'm the Public Health Director of Nursing. And if someone has already had the first dose, and then the region that they receive that dose is going to be reaching out to them to schedule the second dose. And then going forward, as they get first dose, they'll be given instructions how to do that. And we're planning on having an online registration for second doses as an easier way to make that second dose appointment.
Great, thank you. All right, I have some questions from a provider asking if someone signs up to be a pandemic provider, do they have to vaccinate anyone in the community or just the patients in their clinic? And I think that really depends on where within our allocation process and phasing process we're at. As supplies are limited, we really encourage providers to open up their services to anyone in the community. So we know some hospitals have vaccine. We ask them to open up to anyone in the community, not just their patient population. As supply becomes more available, and we talked earlier about having supplies within, outpatient clinics, however far down the road that may be, when we get to that point, we'll probably have enough vaccine in the pipeline to be able to do just your patient population. Yes, you can bill for admin fees. And that is outlined in the provider agreement. we have a question about rural counties and independent pharmacies. So we already have started onboarding some independent pharmacies in many counties, and these are to partner with our long-term care facilities, but in rural counties where there's less facilities such as hospitals. I know we have counties without hospitals. We have some counties without even retail pharmacies. Yes, we will go ahead and look at doing independent pharmacies there. Those would be places that we'd also look at partnering with FQHCs as well. Do community providers need to bring a work badge or an ID with them when receiving vaccine from a health department?
If they have their facility ID, that's great, just to verify who you are. We are not checking IDs per se for age.
Great, thanks. We do have a question about does someone have to get their vaccine in their home county, or can they go to a neighboring county to get that vaccine?
Since the vaccine is allocated based on population, we encourage people to get the vaccine in the county where they live or where they work, but we understand that there are some occasions that may not be possible. So we would not turn someone away if they did not necessarily live in that county.
We have a question that I believe is directed for Natalie for tennis. I'm going to ask you to send over your email address if you put this question in so that we can follow back up with you. But the question is, do you have a way to convert XMX or XLS or CSV to HL7?
No, we really, and this is also a response for Dr. May as well, because we have so many interfaces, we really only accept HL7 messaging at this point. It's either an HL7 message interface or leveraging the mass immunization module.
All right, we have a question about if you're a provider in 1A1 population you haven't been contacted, please reach out to, I'm going to put it in the chat, or Natalie, do you have this up? Can you put it in the chat, the VPDIP?
Well, I am in as a participant, sorry.
All right, so I will put it in. Let's see here. All right, so if you are a phase 1A1 population provider and you serve that population, I have put the email address in the chat box. Feel free to reach out to that and let us know. All right, looking through the questions, it looks like we've answered a lot of these, so I'm trying to get to a new one. All right, we have a question about liability for EMT vaccination, volunteer workers, and for physicians who are semi-retired with no current malpractice who want to volunteer. Anyone who wants to volunteer can go to our volunteer mobilizer page. Do you know that website, Jenny?
I haven't, but it's
okay, so we can find it and put it in the chat box for you. When I look for it, I can't lie to you. I just Google MRC, so it's Medical Reserve Corps is what that stands for, MRC in Tennessee, and I find it that way, but we can also get you the link for that on our website. If you go to that little yellow bar, when you go to tn.gov/health, you can click on that, and there's a tab for volunteering, pretty much. And so that'll get you signed up with our Medical Reserve Corps. Just had another question about the the number of vaccines reported by the federal government. Again, we have not heard any official terms from the federal government on that, no official word from the federal government on that. So nothing official that I can report on. All right, we have a question about CDC reports 656,000 doses sent to Tennessee, of which 264 have been administered. Where are the other doses? So for this, I'm actually going to go to our website. I'm going to pull up a nice little, let me make sure you can see it. All right, so let me go to our website. It's thinking. So this is where I like to push people to. So this is the total doses delivered is a great place to check on where vaccines at within Tennessee. And so as of right now, we have delivered, it looks like close to 135,000 doses of vaccine, both Moderna and Pfizer, within public health. So these are our local health departments. We've allocated or delivered close to, or it looks like over 250,000 doses to other providers, which are going to be right now our hospitals and some of those small independent pharmacies, for a total of close to 400,000, 385,000 doses delivered. And again, these data are from Tuesday. They'll be updated again today. What gets us is right here. And so these first doses allocated, this is what we've sent directly to our long-term care facility federal pharmacy partnership. So this has gone to CDC and Walgreens for them to do their efforts in vaccinating our long-term care facility staff and residents. And so that's where a good chunk of our vaccine goes to, right off the top. But again, so this will be, they take a little bit out of each of our allocation for, I think, through January, and then after that we'll be able to fund, if you will, all of the long-term care facilities, but funding with vaccine, of course, and be able to make sure we have enough vaccine to cover those populations. So that's a really good place to go to when you want to look at where the vaccine is in Tennessee. Again, this is a little dated. It came out on Tuesday. We've had an allocation since then, and we've had deliveries come out since then. So I would highly encourage you to check it back today for more updated data.
And I want to add to that, it also shows, again, the importance of reporting administered vaccines to tenants, because these numbers, if Cassie can scroll back up, the bars and the map, these numbers are pulled out of tenants, so we are really relying on the providers to report how much vaccine they have administered, because that's what's driving those numbers.
Great. All right. I'll go back to my Q&A screen. Wonderful. All right. It looks like that's actually the end of the Q&A questions. Let me hop over to the chat box, because I know there may have been some other stuff in there. I have to tell you what I'm doing so it doesn't sound like I'm just sitting here. Sorry about that. All right. Well, if I can find the chat box. There it is. All right, that's one we've already answered. So we do have a question about, are we holding back doses for second shots currently? And yes, currently the allocations that have been sent out to providers, there is a second dose attached to that. Again, we have not heard anything concrete from the federal government, so I can't speak on upcoming processes, but all right, I think those were, let's see here. just a question about days on when orders are submitted and when those arrive in the counties. And so one thing I do want to point out is one of the question says, when do the counties order the doses? So counties are not responsible for ordering doses. We actually allocate directly to them, and again, that's based on population. So this isn't something that the county requests or orders, it's something that we give based on population. And that process has changed, and so that's, there's not a real set schedule right now at current, but we're working towards getting a set current schedule, or a set schedule for that. All right. So that was the last question in the chat. Let me see if I can pull up that Q&A one more time, just to make sure there's nothing there. Okay, I do see a question about veterinary professionals. Currently, veterinarians are split between two different things. So if they directly work with the commercial agriculture or a commercial food supply, they will be with our critical infrastructure in phase 2. If they are not directly employed by a commercial agriculture or commercial food supply company, then they are based on age and comorbidities. A question about where to look for updated information on the vaccine, especially for safety as more people are being vaccinated. I would always point people to the CDC website. They have great resources. You can also go to the FDA website as well. And of course, we link to the CDC website so that all of our stuff stays current as CDC updates their information. All right, it looks like that's the end of the questions I see. We have just a couple more minutes, so I'll give it another 10 or 15 seconds or so to see if somebody else sends in any more questions into the Q&A box. Oh, we did get one more. How soon will other pharmacies that are part of the federal pharmacy partnership be included in vaccine allocations? I think that just depends on when our vaccine allocation opens up to allow that, and we currently don't have visibility on our future allocations from February on. So I wish I could answer that question. I just don't have enough information yet to be able to. On the chart that we saw earlier, it looks like potentially March, but that just really, again, depends on the amount of vaccine we get. Have a question regarding outreach specifically to minority and populations, and we are working with our Office of Minority Health to make sure we have efforts in doing that. So we are working with our partners in the Department of Health and outside of the Department of Health to work on that. Question about the Walmart partnership. We're going to start the rollout with counties on 2/1 with the higher SBI. So that's what the start of that looks like is with counties with higher SBI. And then as we begin to receive more vaccines, we will broaden that out to other counties as well. Had an ask to repeat about holding back doses. So we currently, under the process that we have not heard, again, differently from the federal government, that we have a dose tied to every dose that we've allocated so far, a second dose tied to that. Again, we have not heard any differently so far, and we've been told that for now that the cap is that we'll have second doses coming out for that as well.
allocate, there was a question about having people over 75 and essential personnel, such as healthcare providers, that are on a waiting list. And that is correct. Each county does have a waiting list just because of the supply of vaccine that we have. And as soon as we have ample supply of vaccine to meet whatever number the person is on the waiting list, they'll be contacted and given an appointment to come in and give that vaccine.
Great. Thanks, Cindy. All right. Look one more time. It looks like we're right at time. So let's make sure there's not anything else. A question about if they received a first dose through a Metro Health Department point of distribution or a pod. Will they be doing a pod for the second doses as well? That's a really good question. We aren't necessarily partnered, well, we are partnered, but we don't have as much visibility into what our Metro partners are doing. I would assume that they would have a second dose pod for that as well, but you may just want to check back with them on their website or through an email or phone number you may have for them. All right, it looks like we are right at time. So thank you all for joining us today, and we look forward to chatting with you next week. Thanks, everyone. Have a good day.